Welcome back. It's Ask the Expert Day, and today we're talking about balance issues as you begin to age.
Yes, and maybe you're not quite there yet, but you may have some parents who are. This is Jess Moulton. He's from Utah Valley Regional Medical Center's Hearing and Balance Center. Thank you for joining us today.
Good to be here.
What are some things we need to look for when our parents are aging, when we're aging, those kind of things? You said, we were talking just a minute ago, you said the balance issues are kind of inevitable, but what do we need to look for, and when do we start needing to get some help for our folks or for us?
Well, we talked briefly about how serious it is to sustain a fall. And obviously it would be important if we could be proactive and identify risk factors for falling. As we age, we're going to have problems with muscle weakness and joints and loss of sensory perception in our extremities and poor vision. All these things kind of contribute to the problem. But a fall, if it results in a hip fracture,
Can really set you back.
yeah, the morbidity of falls is pretty serious.
So let's talk about when you go to your doctor. You said there's things you can do so that you're prepared when you go, that you can really get to the bottom of what the problem is. You said take notes. So what would you take notes on?
Well, it's very common for us to see patients who come in and say, well, I'm dizzy. But being dizzy can mean a lot of different things. If a person is unstable, it could be because they have neuropathy in the bottom of their feet. They don't have a perception of the ground underneath them. That's totally different than someone who feels like the room is spinning.
Mm-hmm. So how can we help our parents? Let's say our parents are getting into these balance issues now. What can I do as a son to sort of help them through all this?
Well, there's a litany of things, that kind of lead up to the problem. Taking more than 4 medications. And kind of, we kind of take it based on the symptoms that they report, because, again, if they were spinning, there's several things that can cause that. And so we have tests that are appropriate to provide the right diagnosis. And so it's really figuring out what's causing the symptoms, and then we address it as we go. It might be physical therapy, there might be medications or some other treatment that will help.
Perfect. Thank you for answering our question.